allergies. For 15 years in practice, I never treated allergies. Why? Because it didn't help me. It didn't help cure cases. So you had allergies, hay fever. I give you some quercetin. That's not real healing for me. Okay? Then Dr. Wilson introduced me to IgG food allergy testing, and it changed a lot of the way I practice. And I was doing pretty good before. So why do we test for hidden food allergies? When you have a hidden allergy, it's the same thing of having a chronic infection. Allergies and infections are the same thing to the body. The body generates allergies because it thinks that that protein particle is an agent of infection in your body. Now, the body is intelligent, but it's not reasoning. So if it sees a protein sequence, and that protein sequence in one case is a bacteria or a virus, and then it sees a similar protein or a DNA in a food, it's going to attack that food. And if you have a similar protein in your body, it's going to attack your body. So let's talk about the allergens. 2 types, IgE. This is what your doctor tests for. This is the scratch test. This is the blood draw test. That's the immediate food hypersensitivity reaction. I don't test for those. First of all, because what I do is not covered by insurance and I don't want to waste my patients' money. Most people have had that test already. And you know if you have those. If you eat peanuts and you can't breathe, don't eat peanuts again. Okay? If you eat strawberries and you get a rash, stop eating strawberries. Okay? But there's another part of the immune system, and that's called the IgG. Okay? That's the hidden food allergies. Those occur 2 to 5 days after being exposed to the food. You never know if you have one. They just brew underneath the surface there. My dad made me get a new pointer. They just brew underneath the surface here, okay, until then you're exposed to a stress, a flu, a divorce, a change in jobs. Then your immune system has an additional stress, and then the whole thing falls down. So IgE is the immediate, okay? IgG is the hidden. If you're not testing for IgGs, you're missing the whole boat, because that's 75% of the immune system is dedicated to IgG food allergens. And we can have a philosophical discussion why the body does that. Secondary infections are really what gets you. If you get the flu, you don't die of the flu, you die of post-influenza pneumonia, those people that would pass to the flu. That IgG is the system that protects you. So the body's pretty vigilant about that. Recent research this week, these IgG food allergens don't last 2 to 5 days. They last 2 to 20 days. So that means you eat something the 1st in the month and you have a migraine the 15th of the month. Are you ever going to associate those two things? Never. It's not in our human ability to do that. So I did both of these photos. I want to see which one worked. I don't know if either one works, but IgG allergens are like hidden food allergens are like a hole in the bucket. There's no way to cure a case. And we saw this in naturopathic medicine. You'd give adrenal support, or you'd give some herb, and the patient would feel better. And then they'd stop the herb, and they'd feel worse again. And I did that for 5 years with thousands of patients. And I got frustrated about doing it. Here's an example of an IgG, or hidden food allergen test. This is from that patient we saw the symptoms of the first time. Okay? So is there any inflammation in the system? You better believe it. Okay? How often are you exposed, unless you're avoiding your allergens, exposed to eggs on a day? How often are you exposed to eggs? Every day. So this woman has an infection every day for 20 years. Do you think she's going to have some symptoms? You better believe it. If you had the flu every day for 20 years, do you think you'd be a bit drained? Yeah, I think you would be. Anxiety? Yeah. Depression? Yeah. Joint pains? Yeah. It would all be there. Not everyone has IgG food allergens. Okay, I'm not saying everyone does. Sometimes I'll take someone that's nice and healthy, and maybe it's a mom of an adopted kid I'm treating, and I'll say, you're 50 years old, you're the CEO of your own company, you work out every day, you have any problems? No, I feel great. Let me test your IgG. That's the test I get. So, this person's the GOAT. This person can't make it to work. I'm not saying this particular person. Maybe I'm saying me. This person's acting out in school. This person's hyperactive. This person's depressed. This person's a head case. And this person's a hero. Simply because of the way their body's being affected by what they're being exposed to in their foods. And this is really the truth. I've seen so many kids go from problem to hero in the classroom just based on this. Okay, I have 2 boys. What I hear consistently from the teachers, they are a pleasure to be around. And they are a pleasure to be around. Let me tell you, there's Quinn and Sterling right there. Go up and say hi to them after. They're off their IgG allergens. They are a complete pleasure. I have not had one day of a problem as a parent. But because their system's not being irritated. Okay, here's the egg allergy, extremely high. Okay, that's antibodies the body's generating per unit of antigen. Okay, here's milk allergy. Okay, look at this person's milk allergy. Okay, they didn't know. They could drink a glass of milk and have no symptoms. It wouldn't show anything. It might show 15 days later. There's a gluten allergy. Okay, gluten, we check. Barley, corn, oat, rye, spelt. Here's 2 sisters I just tested. They came from Manhattan to get tested. And it's just so interesting. Can you see like the correspondences here? And then here? And then down here, the groupings? So it's really interesting to me to see the different family influences we have on that are affecting these IgG. And I'm sure our immune system was programmed. More and more I'm thinking that I don't think we should eat a bunch of foods. I think we're probably programmed to eat a very limited amount of food that's super good for us. So it's kind of 1 or 2 options you're going to have today. You can limit your life, which I spent 15 years doing. Couldn't go out, couldn't go to things. I went to a restaurant once, had to get up 10 times to go to the bathroom. Or you can limit your diet. Now, I'm not saying either one's easy or either one's ideal. Yeah, ideal would be you take a pill and it turns off the stupid allergy to eggs, and you can eat eggs and be fine. I don't have that yet. I'm on the lookout for it. If you are inventing it, please clue me in. I limited my life for a long time, so I have no intention of doing that. So here's on our my little survey I sent out. 91% of people say that going off their hidden food allergens changed their case for the positive. Some tremendously for the positive. That's pretty dang good. That means we're doing something right. It's money well spent, right? Dairy usually is emotional issues, bipolar. Egg is usually immune disease and cancer. 90% of my cancer patients have egg allergies. Consistently. You give me a 50-year-old woman with breast cancer, I guarantee you she has an egg allergy. Don't you think that's pretty important to find out?